It's such a delight to connect with you this afternoon, this beautiful Saturday afternoon. More than ever before, I'm grateful for every moment that I live, for every moment that I breathe. I will never take it for granted, and I don't think we should at all, that God has kept us here, kept us whole, kept us in peace and joy. And despite any challenge we're going through, really, there is hope for the living. So I just trust that you're keeping well and your families too. Today, we're going to be talking about health, and I'm going to start with a scripture. 3 John chapter 2, the King James Version reads, "Beloved, I wish above all things that thou mayest prosper and be in health as thy soul prospereth." The Amplified Version takes it a step further to define what aspects are actually prospering. It reads, "Beloved, I pray that in every way you may succeed and prosper and be in good health physically, just as I know your soul prospers spiritually." Physical health is intricately linked with health in every part of our lives. When you're not feeling well, when a person is not feeling well, spiritual health suffers. It's not easy to pray, for example, when you have a pounding headache or you're incapacitated through back pain. Emotional health, one feels drained, tired, wondering what's going on. Psychological health, one may feel defeated, and there might be some kind of psychological deficit or feeling that, is there a solution? Is there a plan for God for me in ill health? Social health, of course, we know that not being well affects our relationships socially, and of course, financial health. It can drain our resources, in many ways. Money spent, actually visiting the doctor, paying fees. It can also drain our financial health in terms of lost opportunities. If one is in hospital or one is not feeling well that day, then you may not be able to make money on that day or that month or that year. And that will not be our case in the name of Jesus. Amen. Lack of physical health, being unwell in any way, takes our attention away from other things. And the best way I can describe it is, if you have a pain in your little toe, you'll be surprised that the whole body suffers. And until you solve that little issue, you may not be able to proceed. So the old adage holds true. Health is wealth. And that's why we're here today, because health is important. Dear women of destiny, health, good health, is a key success factor for our destinies. It's a challenge to fulfill destiny while battling significant ill health. The good news, there's a balm in Gilead. Jesus came and he died so that we might have life, and life more abundantly. By the stripes of Jesus, we have been healed already. And as we go through this meeting, I just want you to apply the stripes of Jesus, the blood of Jesus, the resources that God has given us already. Even though you may not see it now, you were healed 2,000 years ago. So I'd like to pray with you that Almighty God will heal you and make you whole, Amen. Body, soul, and spirit, Amen. In the name of Jesus. May you prosper and be in health, Amen. Even as your soul prospereth. May your healing be permanent in the mighty name of Jesus. And that Amen. Healing will be physical, spiritual, emotional, psychological, financial, Amen. Emotional, Amen. In the mighty name of Jesus. Amen. I say, dear woman of destiny, go forth and prosper in wholeness, Amen. In Jesus' mighty name. Amen. I love you all. Thank you for listening. And I hand back to our facilitator, our mommy, our sister, Pastor Weju Adenusi. Thank you.
Thank you so much, ma'am. It's always a great blessing hearing from you. And it's my prayer that every prayer that you have prayed for us this afternoon indeed shall become testimonies in Jesus' name. Amen. It's my pleasure, to hand over to the anchor of the day, Pastor Marie Fido. God bless you, ma'am. Thank you so much.
Thank you, ma'am. Thank you, Pastor Femi. We're richly blessed by your prayers. We're always happy to have you in our midst. And we don't take having you around for granted. Thank you so much. So at this point, I'd like to introduce our guest speaker. Her name is Dr. Jibike Oyewunmi. She's the CEO and principal consultant of COLORECTAL Advisory Services, which provides quality management and patient safety supports for healthcare organizations. She's also an obstetrician and a gynecologist. She became a fellow of the West African College of Surgeons in 2001. In 2002, she joined the Lagoon Hospitals, Lagos, as a consultant, OBS and Gynae. She became the first quality improvement and patient safety head for the hospitals in 2005. She led the effort that culminated in Lagoon Hospitals becoming the first hospital to achieve the Joint Commission International Accreditation in Sub-Saharan Africa in 2011. She has worked as a quality improvement advisor at the Health Quality in Ontario, Canada, and the Institute of Health Policy Management and Evaluation at the University of Toronto, Canada. In 2017, she came back to Lagoon and then went on to achieve the second JCI accreditation in March 2018. Dr. Jibike is currently works part-time as the Director of Quality at Lagoon Hospital. She also works part-time as a consultant to conduct quality assurance assessments for hospitals and to provide advice and support to the hospitals for improving quality and patient safety. She is a board member of the Society for Quality Healthcare in Nigeria since 2007. She serves on the technical committee that developed the quality standards for hospitals, which was accredited by the International Society for Quality. She's also an author. She's the author of the SQHN Standards Guidebook, which will provide guides to organizations on how to comply with the standards. She's also an author of the Standards Surveyor Guidebook, which will provide support to surveyors for the organization on how to assess the standards in hospitals. She has various professional qualifications. She has taught in various workshops and has taught healthcare professionals in various countries. She's passionate about building capacity for improving healthcare systems and the delivery of the best care to the patients. Her greatest desire is to see the Nigerian healthcare system rise to fulfill its role in the lives of its citizens, which is also part of why she's here with us today. She wants to see all of us rise to fulfill our roles as women, rise to understand our healthcare requirements and issues. Join me as we welcome Dr. Jibike Oyewunmi to talk to us about our health as women and our OBS and gynae health and our health in general and all the things we need to note as women, especially women. So for some of us, I'm quite interested in knowing things around my age, things that concern me now, menopause and all of those things, perimenopause. And I'm sure we all have various things that we want to talk about. So Dr. Jibike, welcome. We are excited to have you here and we look forward to learning so much from you this afternoon.
Good afternoon, everyone. And thank you so much for the opportunity to be in your midst. Apologies for the long introduction. You were supposed to have gotten a much shorter bio. You don't need to have all that, those facts. So sorry it took you so long to read it out, but it's good to be here. Good afternoon, Dr. Femi Piton. All protocol observed. My big sis, Aunt Pedro, thank you for inviting me here, and everybody else. It's really a pleasure to be here. Now, I love the song that was, that you sang just now, which says, I know who I am. The song says, I know who I am, right? And one of the things that we are, that God says we are, is that we're a temple for his presence, we carry him. We are a temple for his indwelling. So if we know that, then it begins to help us understand why, as Christians, we must look after ourselves. I remember in them days, the Christians were, I'm sure many of us experienced it, felt that, it was vanity to look after the body. But we know better, that we have to look after this body because God says he dwells in it. And who are we to treat the dwelling place of the Spirit of God shabbily? Why should we do that? Why do we feel we can do that? And as Auntie PJ said, because we don't have knowledge, we may not do what is right. But thank God that he provides knowledge for us. Thank God for science. Thank God for what science has done. And I tell you that science has made me even more acutely aware of the spiritual aspect, because there's a limit to what science can do. What we will do is to look at some of the top women's health issues. I try to look at it across the spectrum, the age spectrum. We'll look at the risk factors. We'll look at some of the symptoms, and we'll look at prevention, which is really, where we should be. I hope you will type in your questions into the chat box so that when we're done, I will try to move pretty fast. There's a lot of information in here, but you can get the slides and then we can look at questions. So there are, if you go on the internet, Dr. Google, you will find out that there are many, different websites look at the top health issues differently. But these are the ones that I have picked that I think we need to look at. And we'll look at the female specific cancers. We'll look at heart disease, as your mom said, guard your heart. We'll look at stroke, which is linked to heart disease. We'll look at fertility. We'll look at depression. We'll look at fibroids. And because I know that fibroids is once again a very hot topic. And I think it's something that we just should talk about so that we can calm ourselves down. Of course, we'll look at menopause. Now, this is what the female reproductive organs looks like. Sits down in the pelvis, in that area. And this is what it looks like. The uterus, if you cut it. So this is like cutting it in half. Going up, like along the face, like that. If you cut all the way down, this is what you would see. So that's the ovary, that's the uterus, the cervix, that's the vagina there, right? And the uterus is made of muscles. It's made of a soft lining, which is the endometrium. That is what, controlled by hormones, sheds every month based on the hormonal flux, sheds every month as the menstrual flow. And then that's the ovarian, the fallopian tube, okay? Which picks up the eggs from during ovulation and carries it into the uterus. Okay, so I'm going to start out with cervical cancer because it's something we've all heard about. I hope everybody gets to do their pap smears and get it done properly at least once every 3 years. Okay, cervical cancer, the symptoms usually are bleeding in between periods, so what we call intermenstrual bleeding, or after sex, which we call postcoital bleeding, pain during intercourse, longer or heavier periods, unusual discharge, which usually has, well, at the beginning, maybe just a little more than, and then it begins to acquire an odor. So if you have any of those things, you need to speak up. And then for menopausal women, bleeding. In fact, any kind of bleeding in a woman who's menopausal is not a good sign. What are the risks? How, what predisposes us to cervical cancer? The main thing is this human papilloma virus, which is a sexually transmitted infection. The human papilloma virus has been associated with cervical cancer clearly. Of course, HIV infection, smoking, younger age at first sexual intercourse, because it said that the cells around the cervix at that time are not mature enough, and so they can get affected. And then, of course, the risk of human papilloma virus, large number of sexual partners, oral contraceptive use greater than 5 years, having more than 4 full-term pregnancies, and other sexually transmitted infections. Of course, with the human papilloma virus now, you know that there is a vaccine. So for those who have young children or young grandchildren, please consider getting them the human papilloma virus vaccine, because you see this infection is not necessarily that it's when you have sex early, even when you're married. Because many of us, the reality we need to face is many of us were not in Christ early. And so you pick up things that may carry into marriage. So this infection you can get even when you and your spouse are monogamous and faithful, because it's something that could have come from an earlier time. So please consider it. Then for the uterine cancer, which we also call endometrial cancer, that is it's the cancer of that lining that I was telling you about. Usually the symptoms are watery discharge, which usually smells bad. There's discomfort or pain in the abdomen. There can be pain when peeing. Oftentimes that usually is when it begins to spread. There's pain during intercourse, and of course there's bleeding, either in between periods again or postmenopausal bleeding. The risk factors for those for uterine cancer will be age. As one gets older, in fact, almost all cancers are higher, get more with age. When your period starts very early, and there's nothing you can do about that. When your period doesn't stop on time, so the average age of menopause is 48 to 52. For those who have longer menopause, then there's a higher risk of endometrial cancer, and that's because the endometrium is active, is active for longer than it should be. For those who do not, nulliparity, those who don't have children, because again, the endometrium is being stimulated all the time. When you have children, it calms down. The baby sits in there, and there's really no activity on it like that. There's a genetic predisposition, the use of hormones, endometriosis, diabetes. But however, there's some protective factors, which we know, using oral contraceptives, pregnancy, breastfeeding, when you remove the fallopian tube, and sterilization. Okay. Ovarian cancer is the other one we need to think about. This one in particular is, it's quite silent. It's a very dangerous type because it doesn't show symptoms oftentimes till it's late. And so one needs to be aware, and we'll talk about screening, health screening. And it's one of the things that you should get them to look at least every 3 years, get them to look at the ovaries. So when the woman is bloating, where you feel bloated all the time and you have abdominal cramps that you don't understand what it is, early satiety, as we say, you eat a bit and you feel full, yet you know that you've had very little to eat, and then peeing very often. These are symptoms that should alert you, and you don't ignore them. Please go have it checked out. Risk factors for ovarian cancer will be when there's a family history of breast or ovarian cancer. There's a genetic mutation, we won't talk about that because we don't check it here. When you use hormone replacement, so for those who are menopausal and they have very problematic menopause, the doctors tend to offer them hormones. That can be a problem. Or if you're using hormones for other forms of replacement, and that's the female hormones. The more menstrual cycles you have, the higher the risk, okay? And of course, age. Factors that would reduce your risk will be having the ovaries and tubes removed, childbearing, breastfeeding, oral contraceptives again, and then tubal ligation. Then the next one we need to talk about is breast cancer. I'm sure you've all heard about this over and over and over and over, but it is something that bears talking about all the time. We're seeing cases, not beginning, it's been going on for a while, younger and younger people getting breast cancer. And I think that's, largely environmental, but also hormones. We're using a lot of hormones now to treat fertility issues, to manipulate the periods when women don't want many babies anymore. So they're using hormones a lot. And that is affecting, the breast cancer. So what are the things to look out for? I hope everybody knows how to do the breast examination, standing in front of the mirror, look at the nipple, squeeze it, any discharge, any lumping or thickening of the skin. Does the skin look thickened? If you can see a visible lump, from the skin, you can actually see something protruding. You can see dimpling, what we call it's almost as if there's a rope tied to the skin on the inside and pulling it, okay? Or the nipple being pulled in. When the skin looks like it's irritated for no reason, pain in the armpit and the swelling in the armpit, which might be the lymph node, or even a change in the texture of the skin. You can see the skin looking like orange peel or fruit peel, orange or lemon, or that kind of thing you need to be worried about. And the risks of breast cancer, and for all the cancers really, you have what you call the non-modifiable risk factors and the modifiable. Non-modifiable risk factors are the things that you can do nothing about. You can't do anything about your age, unfortunately. Yes, we wish we were younger. You can't do anything about your family history. You can't do anything about your genes, right? You can't do anything about the type of breast you have, the density of the breast. You can't do anything about it. But you can do something about your weight. You can manage your weight. You can do exercise. For those who drink or smoke, they can quit. Breastfeeding, we can do something about. Many women, I've met women who say they don't want to breastfeed because they don't want their boobs to droop. And I'm wondering, okay, I wonder which one is better. Okay, hormone replacement therapy can also help. So what you will be saying, somebody said to me, you doctors confuse us a lot. One thing, you say hormone replacement is good, then in another place, it's not good. Unfortunately, that is just the reality of life. It's good for some things, it's not good for some other things. So hopefully you would find a good doctor that will be able to help you weigh your risks, and help you balance out. The other one that, we're seeing more and more, it used to be more a disease of men, but we're seeing it a whole lot more in women. I was looking at the statistics worldwide, a few days ago, and, I saw the totals for 2020. And the risk of colorectal cancer in women, the incidence seems to be increasing. Okay, and the signs and symptoms of those usually, for many people, you won't see anything. They just say they're anemic. They can't find anything else. They're not bleeding. There's no source of bleeding anywhere, but their blood level is low. Every time you hear that, two things should come to your mind: either leukemia or colorectal cancer. Okay. Then when you have change in bowel habits for no reason, you didn't change your diet, then the bowel habits change. So you begin to have diarrhea, constantly, or constipation and no change in your diet. then you need to think about that. Blood in stool, persistent abdominal discomfort, cramps, gas, so that you begin to think about ovarian cancer and colorectal cancer. A feeling of, when you go to the bathroom to empty your bowels and you keep feeling like it's not fully emptied, you need to check what is happening. Okay, and the risk increases such that by age 50, you actually should be having regular checks for colorectal cancer. And there are different ways of doing that, either by doing a stool test for them to check for blood in your stool, or to have somebody put a tube up, what we call a colonoscopy, and have them look to see if there's anything there. From age 50, you should have those tests done, the stool test if possible every year, or at the maximum every 3 years. Okay, and if there's a family history of any of the cancers, then it may actually be more frequent. Okay, the factors that contribute to risk for colorectal cancer are when you have low vegetable and fruit. So it means that usually for people who they have low vegetable and fruit intake, the food doesn't pass through their bowel on time. So it has time to stay in, stool has time to stay in and irritate the gut. So it's a good idea to make sure you go to the bathroom every day. Your diet should be encouraging you to do that. Lack of exercise, being overweight, alcohol consumption, high salt intake. Okay. Now, you would see that, as I've spoken, there are certain factors that are common to all this, that contribute to the risk of all this. One is tobacco. Thank God we're seeing, reduced use of tobacco. And please remember, tobacco is not just you smoking yourself. Secondhand smoke can be just as dangerous. Excess body weight is the other thing that is proving to be huge. Now, obesity is a problem. It's a major problem. It contributes to just about every kind of disease in this world. Everything. Obesity is linked to everything. So losing weight, getting your body mass index down is a must. It's a life-saving thing. It's a must. We must do it. Alcohol, of course. The ultraviolet radiation is an issue, even though, we have black skin, so it tends to protect us a bit, but it's not totally protective. Okay. Our poor diet, a lot of refined flour, refined food, preservatives in our food, all the canned food that we're eating. Fertilizer in our food now is something else. Okay. Infections, and of course, physical inactivity. Exercise is a must. In fact, I've been looking for someone who will start doing Christian yoga. I used to do it when I was in Canada. I haven't seen it here because that is good for those of us who are a bit older and you're worried a bit about your joints and you're looking for something to stretch you and help you really exercise and lose weight. Yoga is a good one. Okay. So those are the main cancers that I will talk about. I mean, that is not to say women are protected from all the other cancers. The other one that is on the rise, we're seeing more and more, is lung cancer. And again, it's due to the pollution in the air and secondhand smoke and to factors that we don't know about. Okay. So I'll go to the next one, which is depression and anxiety. Thank you, Dr. Puton, for, talking to us about prospering in health, mental health, emotional health. It's a big thing. I'm sure you'd have all seen the news every now and then, the ones that are circulating, increasing risk of suicide, especially with the COVID, increased depression, people are struggling, and it is real. The fact that you're struggling doesn't make you any less of a Christian. It is how your Christianity impacts how you handle it. But please do not let us deny it because it is a real issue. For women, if I'm looking at it specifically from the point of view of women, there are certain conditions that affect women, you know, almost regularly. Premenstrual syndrome. I remember how I used to suffer when I was younger, and I didn't know what it was. All I knew was that almost every month, there will be a reason why I'll cry, and then it will go away. And then when I became a gynecologist, I then noticed that, oh, come on, it's about the time of my period. Oh, okay. Just knowing what it was enough to help me. Just knowing that this thing, it's a hormonal, it's because the hormones are swinging. Okay, so premenstrual syndrome for many women is very real. They feel down about the time, about 2 to 3 days before their periods. Then there's one called the premenstrual dysmorphic disorder. It is similar to the premenstrual syndrome, but it is intensified. So you may have, you know, friends, daughters, granddaughters who feel, you know, you just notice that they can be quite moody, you know, regularly you are moody. Please ask them, see how it relates to the timing of their cycle. Just knowing what it is often helps. Then there's the baby blues. You know, when women have babies, they tend to feel slightly depressed. Of course, we all want to deny it. Oh, it's something of joy. Now, why should you be feeling depressed? Hormones have been withdrawn from this woman. And for many women, it will impact them. Then the fear, you know, what do I do with this baby? How do I cope? All that. These are things that we must recognize. Okay. Perinatal depression, stronger, you know, can be associated with a lot of sadness and all that. We're seeing it more and more, and it is real. But if we help these women properly, support them, they will get out of it. Then perimenopause. I'm sure all the people who are in that, they know what I'm talking about. Perimenopause, that's your husband will run out of the house because even you don't understand what's going on with you. And many, many women, I know many women who have felt down, and you know, when they talk to me, I'm like, it's menopause. You're going through the perimenopausal period. They're like, oh yeah? Yes, it is. Again, knowing what it is you are dealing with is half the problem solved. Most people will not require medication. Most people, omega-3, you know, some of these herbal medications, evening primrose oil. Exercising is big. Exercising is big. Being out in the sunshine is big. Keeping active. Meditation, very helpful. Okay? And of course, surrounding yourselves with good friends and holding on in faith, right? Faith does not mean you shouldn't seek help. So we will not condemn anybody for seeking help. If they need medical help, then they get medical help. That is part of the gift that God has given us, that we can find people who can find solutions to our problems is in itself a gift. Then the next one we'll talk about is coronary heart or artery disease. Coronary artery disease actually leads to coronary heart disease. This is what the heart looks like. The heart itself, even though it pumps blood, that's where the main pump, you know, the pump station is. It's all blood inside. In itself, it's made up of muscles and it has blood vessels that supply the muscles. Now, if there's a problem with these vessels, that is, you know, it begins to affect the muscle of the heart, and that's coronary heart disease. Okay, so this is what a healthy vessel looks like. At some point, you could have a plaque being deposited, fatty deposits inside. So, you know, we'll talk about cholesterol. It becomes, you know, it gets deposited inside, and then more and more and more. And you can see that as it's going down, the blood flow there is narrowing. And at some point, it can actually block it off. When it becomes occluded or blocked off, that's part of what causes a heart attack. If the blood vessel is a main one, like one of these ones, then it can cause a really massive heart attack. Okay, so of course, and then sometimes this yellow thing can break off and go down towards a place where the vessel is narrower and block it off. Okay, again, that can give a sudden heart attack, and it can be massive, as you all know. Now, what are the risk factors for heart disease? What can be changed, what is modifiable, and what cannot be changed? The risk factors: smoking, overweight and obesity, we're seeing it again. Overweight and obesity, diabetes, especially if it's uncontrolled, high cholesterol, sedentary life. You know, a sedentary life. I remember my auntie coming into my house recently and making fun of me because I have a house helper, and I sat in one place and I was calling my house help. She was like, Shebi, it's you and I that were in Canada. So did we have anybody to call? Yeah, I enjoy, you know. We see it as enjoyment, but it can actually be deadly for us. We must not be sedentary. We must get up. And nowadays, especially, many of us are working from home. I find myself sitting at my computer, working for 3-4 hours straight. No getting up, no nothing. It is said that sitting is the new smoking. So you may not smoke, but you're sitting down a lot. It's even more dangerous than smoking. So we should start putting sitting somewhere here, smoking and sitting. Okay? Sitting down a lot is just as dangerous as smoking, if not more. So please, a sedentary life, get up, get around, do things, exercise, move around. Housework does a lot of good for us. You can't imagine how much calories we burn. When you make your bed, I found out that when you make your bed, you burn about 50 calories is what I think I saw. I can't remember the exact, but I was blown away by, just making my bed, you know. And then hypertension. Now, the things that we cannot change are our race. Sorry. For the Black people, they're more prone to coronary artery disease. A family history will make you more prone. Age, of course, it goes up with age. Preeclampsia, those who had blood pressure in pregnancy, even though after pregnancy it seemed to go down, the fact that you had the blood pressure in pregnancy puts you at a bit of risk. Now, there are other emerging factors. These are the traditional factors on the right. On the left, you know, things like gestational diabetes, diabetes that occurs in pregnancy and goes away after pregnancy, still presents a risk. Like I said, blood pressure, early menopause. For some people, they go into menopause early. Nothing they can do about it, but it's a risk factor. For some people, they've had to have their ovaries removed for one reason or the other. They've had to have a hysterectomy and their ovaries removed. Early menopause, that increases the risk. Okay? Of course, depression, it's real. It increases the risk of coronary artery disease. Okay? So what are the symptoms? It's important to note that the symptoms in females can be slightly different from that in males. And that is one of the main reasons why women die more when there's a heart attack, at least in places where they can even begin to rescue them. Women have a higher death rate because many physicians and many people don't recognize it. Even the woman doesn't recognize it. Okay, so for men and even for women, you know, sudden pain in the chest that goes into the arm, the left arm, goes up into the jaw, that associated with shortness of breath, or you feel like you have real bad heartburn and the sweating, you're sweating profusely, that is could be symptoms of a heart attack. And I would advise that first thing, if you have baby aspirin at home, please remember, if you have baby aspirin at home, first thing, pop that baby aspirin and then get onto the hospital, okay? But in women, sometimes they have pain, you know, in the back between their, you know, between your shoulder blades. The shortness of breath is the same. Women tend to have more indigestion-like symptoms than men when they have a heart attack. And then unexplained sleep disturbance. Unfortunately, that can also be like a symptom of menopause. So it can be a bit confusing. But I believe that God will help us to be able to know what it is. Give us that sixth sense, if it ever happens, that this is what is happening and I need to get help. So I want us to do a very quick exercise, very quick exercise. This is what you call the stroke risk scorecard. Stroke and the coronary artery disease, same family. They come from the same family. Okay, so when you have a high risk of coronary artery disease, the same factors will increase your risk of stroke. So I want you to look at this scorecard and look at where you may be. Look at the risk factors and look at what you know. For anything that you don't know. So for instance, if you don't know your blood pressure, I would advise that you put yourself in the caution column. If you don't know anything, put yourself in the caution column. Don't put yourself in the green column. You put yourself in the green, which is low risk, only if you know. And do a quick scoring and see where you are. So to be able to score yourself, if you have 6 factors in the green, then 6 to 8 factors in the green, then you are low risk. If you have 4 to 6 factors that are in the yellow column, then you need to begin to work on reducing those things. You need to reduce the risk. You need to work on them. See your doctor. Do whatever you need to do. And of course, if you have more than 3 or more in the red column, then you know that you are high risk and you need to do something ASAP. Okay. So I hope everybody has been able to find themselves there. I won't ask you to. I was tempted to ask you to write in the chat box where your risk lies, but I wouldn't ask you to do that. But I hope you will take it seriously and do what you need to do. Now, to reduce the risk of coronary artery disease, there's something called know your numbers. You need to know your numbers. Your numbers, your cholesterol, you need to have your cholesterol checked. Know your numbers and make sure that you manage your cholesterol, whether it's with diet or with medication. Your blood pressure, you must know your blood pressure. You must know what your blood pressure is. If you are 40 and under, once a year is good. Above 40, I would advise that you start checking your blood pressure at least twice a year. And if it's borderline, then please begin to check at least once every 3 months. And of course, your doctor will then tell you what to do thereafter. Know your numbers, your blood sugar. You need to know what your blood sugar is. You need to be sure that you're about your state. Control your blood sugar, know your numbers. If you're diabetic, get it controlled. Exercise, use your medication, control your sugar. Daily activity. It's advised that you do at least 30 minutes per day or 150 minutes per week of moderate to high intensity exercise. Okay, so know your numbers. How many minutes of exercise do you get per week? Know your numbers. Body mass index, which is what tells you, helps you know whether you're overweight, underweight, obese, extremely obese. Know your numbers, know how to calculate it. If you go online, you will find a BMI calculator anytime. Know your numbers, know what it means. Waist circumference is even said to be more important than your body mass index. Men should have waist circumference of, that is your waist, measure your waist around 40 or less. Women, 35 or less. And your waist circumference is said to be more predictive of coronary artery disease, of heart attacks, than your body mass index, in fact. Because, and it's simply this, the most dangerous type of fat is the one that is around our abdomen. So for people who are carrying a lot of their weight around their abdomen, especially on the inside, it's dangerous fat. So know your numbers. I hope everybody has noted those numbers. Have a place where you put it. Get your numbers checked regularly. Keep an eye on your numbers. moderate exercise, healthy diet, stay away from saturated fats and sugars. Stay away from sugars, okay? Manage stress. Stress is it's very important to manage stress. Find the different ways you need to do it. Use music, dance, find good friends that lift you up. Spend time with God, meditate. Meditate. I find out that, many of us pray aloud and we go. We don't sit to actually let the truth sink into us. It is that truth that sinks in that actually holds us. Okay, so that's why meditation is good. Saying to yourself and knowing that you know that you know that you know. It does, and that doesn't just come by saying it. Okay, so meditation, manage stress. Any situation that is too stressful for you, I beg, leave it. Leave it. Let it go. Manage stress. Okay, so let's look. Somebody did talk about the fact that they wanted to learn about menopause. Let's move into menopause very quickly. Life cycle, we're talking about the life cycle of a woman, right? Of course, not before. We're talking of when they get into menarche, when we get into menarche, from the first signs of our menstrual cycles till the end. Okay, so you have what you call the premenopause, you have perimenopause, you have menopause, and postmenopause. Okay, now perimenopause for many people can start as early as 35. Can start as early as 35, and that's why they say to you, try to have your babies before 35. And these are the things that mark that period. When you have a period, you begin to have your periods regularly, and then as you get into perimenopause, your hormones begin to decline, and you may see that the periods are a bit more irregular. Then you get into menopause when the period ceases, and then postmenopause is thereafter. Some of the symptoms, the main symptoms of the various stages in the premenopause, perimenopause area, like I said, 35 for some people, 40, 45 for some people. Loss of libido, which can be quite a bit of, can cause quite a bit of problem at home. Migraines, very real. Poor sleep, very poor sleep. Mood swings. 1 minute you are up, next minute you're down. Even you are beginning to feel like there's something wrong with me. And believe me, before you know, the people around you are already eyeing you, because your mood, they say one thing now and everything seems okay, and the next minute you're off. There's nothing wrong with you. It's menopause. Okay? Irregular periods and weight gain. That's the one that is, it's a major issue. Then hot flushes. I'm sure those who have experienced it, that thing is only his best experience. It's very difficult to describe. Before I got to that stage and I would be managing patients and they'd be telling me, I would feel like, hey, yeah, I used to look at my mom and wonder why this woman is sweating so much. Now I know. Hot flushes, major issue. Then postmenopause, things like incontinence, depression, which usually would start from perimenopausal, but depression actually gets worse. So you may notice it in our older mothers, grandmothers, as they get older, depression gets worse. And then the loss of bone, which means that it's easy to fall and fracture your bone. And when you fracture the bone, it can be quite difficult to heal. So you need to, we need to get off our really high heels because our balance is also not as good at some point. And if you break a bone, then it's more difficult to manage. Okay. Other symptoms, of course, dry, night sweats, vaginal dryness, irritability, nausea. All these are part of the symptoms of menopause. I've put this other one here because it had more more of the symptoms listed, so you'll be able to look at it. Okay. I haven't talked about the treatment because there's no known treatment per se. Hormone replacement therapy tends to help, but it also comes with its problems, as you would have seen, a lot of the cancers. So you need to manage it. For some people, the symptoms can be so bad that there's no choice but to use it at least for a short period, in which case you're weighing the risk and the benefits. Okay. Then, of course, but things like exercising, like we said, getting out, having a social life, those things help. And just managing the discomfort when it comes. Okay. But if you feel really bad, do talk to your doctor. If your doctor offers you hormone replacement, talk to them about the risks associated based on all your other risk factors, your family history, your cholesterol, your risk for heart disease and all that. All that needs to be put together to be able to decide what you need to get. Okay? Right. So I'll move on very quickly. I know where, time is going into another issue that I know, causes quite a bit of stress for women, and that's fertility. It can be very, very stressful, very stressful. And for me, so I'm going to talk to you about the physical part of it, but I believe that there's a spiritual part to it. And that spiritual part to it is more, in fact, is more about managing yourself. God has dealt with me in very interesting ways. I have experienced a lot of things in my life, and one of them is challenge with fertility. And I remember walking, going on a morning prayer walk at about 6 o'clock one day. This was, 20 years ago. And saying to God, I'm not sure, I don't know what this is about. Because after having done everything, all the tests, and they keep saying nothing, what is this about? And I was listening to my Bible. At the point I was saying that, and I'm sure only God can do that. The next thing I heard was, I was in 2 Corinthians 2. And he said to me, I comfort you with a comfort that you may be able to comfort others. And I was like, God, I will stop the O&G if that is it. Is it so that I can help women? Don't worry. Somebody else will help them. Help me, But thank God, I had my son. I had challenges. I have my one son, but I had other challenges. But I think it made a difference to how I manage my patients. And one of the things that I say to women, and if there's anybody here who has that challenge and is listening to me, is this: you will need to let go. There is, women will come into my consulting room, they're all tensed up tight, crying. And I'm saying, I understand your pain, but what can you do about it other than to accept God for who he is? One of my uncles asked me once, I know I've gone off script, but I feel I'm very passionate about this. He called me, one day, and I just had my prayer. That was like 20 years ago. And I was obviously very moody. My father's brother said, what's wrong with you? I didn't say anything. What's wrong with you? I said, now. He said, this child matter. He said, Jibike, if you have a baby, if God gives you a baby today, will he be God? I said, of course he'll be God. He said, what if he doesn't give you another child? Will he still be God? I said, of course. He said, then leave it alone. Let him do what he will do. Let him be God and stop trying to force his hand. But what that taught me, which I then later found out, was stress, like we've talked about, actually plays a lot of havoc on your immune system. It plays a lot of havoc on your hormones. And you will see, from what I'm going to show you here, especially for women, if you look at it around the ovulatory problems, hormonal imbalance is one of those things that doctors find the most difficult to manage. And it is also related to stress. So it's like a chicken and an egg, right? If you're stressed, if you're not having the baby when you want the baby, then you're stressed, then you make it worse. And then you won't have the baby. And then you're stressed and you make it worse. This is where your faith needs to come into play. I know it's not easy. I can talk to you with authenticity because I have been there. It isn't easy, but it can be done. And so when I get patients, I say, the first thing we're going to do is we're going to take our minds off. Let's go and look for something to do. Get a new business, get a new hobby, get whatever it is, do something. And then we continue the treatment and we let God be God. Okay? So causes of fertility, interestingly, despite what we think in our cultures, I'm sure there are many other cultures, but definitely most of Nigerian cultures, it's always the woman's fault. Meanwhile, 30% is the female, 30% is male. Then there's a 20% where there's some problem, I won't call it incompatibility, but there's a tiny bit here and a tiny bit of problem there. And when you put it together, it's making things difficult to happen. And then 20%, we will never know. God is showing us who he is. That's the way I see it. He's showing us who he is in that place. You won't find anything. You just won't find anything. Maybe he will let science help us find some of those things later. It's his choice. Okay. So you have that 30%. And then for males, I've put some of the causes of male infertility here. You can look at it later. For women, if you remember the anatomy I showed you, so the different factors, whether it's from the uterus, okay, the lining, from the vagina, anywhere along this tract there can be issues that will lead to infertility. If a tube is blocked, you may have infertility. If the woman is not producing eggs, there's nothing to use. If there are issues in the uterus, so sometimes a fibroid that's protruding into the uterus, we're going to talk quickly about fibroids before I close up now, or a polyp, then now we're seeing some other micro things, some syndromes that can impact fertility. The thing I would say to you is this: remember that from age 35, a woman's natural fertility begins to decline. Her eggs are not because a woman is born with all the eggs she has. You don't produce new eggs after you're born. So your eggs are as old as you. So from about 35 going on, the eggs themselves are aged. So they're not as fresh, if you allow me to use that word, and they're not so easy to fertilize. So from 35, you begin to see that. And so I encourage women, if you are 35 and you're having challenges, that is not the time to be visiting all kinds of doctors that do not seem to be taking you very seriously and doing serious things. If by 35 you're still struggling, my advice to you would be this: go to a good fertility center. They are expensive, but if you check the amount of money that women spend on test here, test there, different kinds of medications that would never help them, they would have put together the money for the IVF. So I said to women, 35, they've checked, they said the tube is blocked, leave it, wait, put the money together, 2 years, then go and do your IVF. Don't be spending money. Don't let anybody lie to you. Put your money together, go to a proper fertility center. If you have to save over the next 1 year, it's better for you. But if you are saying that, oh, it's too expensive, and then you're paying 100,000 here, 150,000 there, all the money for the IVF is gone. Meanwhile, those things won't do any good. So please, 35 and above, go to a proper fertility center. In fact, everybody, if you can, right? But the younger age groups, generally, it's easier to manage, okay? And then you have time. The younger you are, the more time you have. When you're 35 and above, you don't have as much time, okay? Now, fibroids. Like we said, this is what the normal uterus looks like. These are some of the kinds of fibroids that you can have in different places. okay? Fibroids really are overgrowth of muscle. They are benign, they are not dangerous. Most fibroids you don't even know. It is said that about 80% of women have fibroids, but because it's not disturbing them, they never get to check and they don't even know. So that's fine, they go on. For many people, especially when they say that fibroids is what's causing infertility, many times it's not. It's because you've done a scan that you've even seen that you have a fibroid anyway. Okay, so you can have different fibroids in different places. The ones that tend to give the problems are the ones that, you know, protrude into the uterus usually, or if it's really big. Okay, so this is a picture using a laparoscope looking into a woman's into her pelvis. See the uterus there, small. These are large size fibroids. Okay, so this is what they can actually look like this, you know. Some of the problems that you know, of course, fibroids are commoner with age, because once the uterus calms down, they say bad girls have babies, good girls have fibroids. When you're not pregnant, you know, the hormones work on the uterus muscle and it begins to grow. So it's just a lump. If somebody tells you you have a fibroid and there's nothing wrong with you, please do not let them touch you. It's dangerous surgery, as you know. Do not let them touch you. Complications of fibroids, you know, pelvic pressure, if it's big. I mean, I've seen fibroids that are the size of a 9-month pregnancy. Okay, discomfort. Some of them could cause really heavy periods, especially the ones that are close to the lining and in there. And then, of course, if you have heavy periods, you can have anemia. And with anemia comes chronic fatigue, sometimes hair loss. I've seen women losing their hair because they have anemia from, you know, heavy menstrual flow. Okay, the ones that affect fertility, like I said, when it's really large and it's affecting the lining of the womb, okay, it can affect fertility. Or when it's protruding into the womb like so, okay, or if it blocks the tube, it can affect fertility. What just happens is that it makes it difficult for, you know, if conception happens in the tube. Okay, the sperm comes, you know, in this way, the egg comes in this way, conception happens in the tube, which is why you know, some people have ectopic pregnancy if there's a block, because the pregnancy can't pass through. So what would happen is the pregnancy passes through, comes in here, but this foreign body makes the environment unconducive to accepting the pregnancy. So in such cases, yes, you may need to remove it. But otherwise, please do not go for a scan. Somebody just sees a fibroid, you didn't even know there was nothing wrong with you, and they say remove it. Tell them no. Okay, again, this I have put here for you to see later, that it's a decision model for you that would help you know whether you want to even consider removing the fibroids or not. If there is symptomatic, we do what you call watchful waiting. Leave it alone. Most fibroids will begin to shrink when you get into menopause. So I'm beginning to round up. Here is a list of recommended screening for you. Annual screening, some of them are annual, some of them you need to do every 2 to 3 years. Based on the age, it's been written there. Please take a look at this when you receive it, so you know what you need to check and how often you need to check. That's why I put this here for you. Okay, what for your annual checks. Some people are very good at it. They do their checks annually, but we don't all do it. Sometimes it seems a bit heavy, you know, the cost. If you look at this, these flyers I have put here, it would help you manage the cost. So you know what is more important. You don't, for instance, if you've had negative pap smears for the last 3 years. You don't have to do it every year thereafter, so you can manage the cost. Okay, so that's part of why I've put this here for you. So we need to stay healthy. That's the only option. Many diseases, once they start, you may be able to control it, but many of them you can't reverse. The best bet is to avoid, is to stay healthy. Okay, so mental health, being conscious of what you think, managing stress, okay, getting good medical care, exercise. Maybe we need to form a women's exercise group in church. So at least if we're passing around by ourselves, nobody is making fun of us. Weight control, very important. Okay, mental health. I can't say that enough. I've seen so much, you know, your mental state even determines how you manage other things, your ability to exercise. Dr. Picknell talked about, you know, when you're not feeling very well, you can't do many things. Same thing in your head. If you're not feeling very well in your head, then you find out that it's difficult to be motivated to get going. So your mental health, let that be a priority for you. So in summary, you must go see your provider, your healthcare practitioner, your doctor, whoever it is, your gynecologist, your family physician, whoever it is. If you have any postmenopausal bleeding, any at all, one drop, you need to go get it checked. If you have a foul-smelling vaginal discharge, if you have lumps in your breast, you're seeing changes in your breast you've never seen before, it's better to go and let them say, you came last month, just check and let me go. Abnormal weight gain, bloating, irritability, irregular periods, you know, fullness in the vagina. If you feel full, that may be from the ovaries. Pain during intercourse, frequent urination, blood in your stools, or if, you know, around fertility, when you've tried for 1 year, and, you know, especially if you're over 35. If you're over 35, if you've tried for 6 months, you want to get help very quickly because, like I said, the clock is ticking away. But I'll say one more thing around this conception, you know, something that is interesting because I've only seen it amongst Christians, and I've seen a few where women come and they say they can't have a baby and they've been trying for 1 year. And you ask them how often they're having intercourse with their husbands, and they look at you as if you're an alien. How often am I supposed to do it? Once in 2 months, it's okay. I don't know how you want to have a baby that way. For young people, you know, we the older ones need to counsel them. What I found was, one, because they've grown up well, they've been brought up to, you know, think about or not think about sex and not have premarital sex. They're having difficulty getting into that, even now that they're married. To have a baby, you need to be having intercourse about 3 times a week. 3 times a week. If you're not, if you're having challenges, can't do that calculation and know where you want to be. Okay? So it's a challenge that we have in the church. It's a real challenge. I've seen so many, and we have to do a lot of counseling. So please, older women, help the younger women to see that now that you're married, it's a good thing to do.
Good evening, everyone. Good evening. Thank you very much, ma'am. It was very insightful indeed. So we have just about 4 questions. I guess you did justice to the questions that are bugging people. So we had only 4 questions. The first one, Dr. Jibike, is taking an aspirin tablet daily prevents heart attack. Is this true? That's the first question, ma'am.
Okay. Not so much for women, interestingly. It's more effective for men and doesn't have the same protection for women. However, if a woman has high risk based on that tool that I gave you, or some other validated tool like the American Heart Association tool that helps you to look at your risk. If someone is high risk, then they use the aspirin. It doesn't confer the same protection like for men. So you have to weigh the risk, because aspirin also, can irritate your stomach. So you really need to think, if you're low risk for cardiovascular disease, there's no need to use it.
Okay, thank you very much, ma'am. That answers the second question, because the second question was, is there a risk with taking aspirin daily?
Yes, there is. Again, it depends on the person. The low dose aspirin usually is not as problematic. And then the other thing is, for those who have to take it, there's something called the enteric coated. You actually see it written on the pack, enteric coated. Those ones are, the aspirin has a coating that makes it friendly to your stomach. So if you have to take daily aspirin, please look out for the enteric coated. They are in the pharmacies, even the pharmacy across my road has enteric coated aspirin. So that's a better one. But again, you take it only if you have to.
Okay, thank you, doctor. The third question is, what is incontinence?
Incontinence is the inability to control an orifice properly. So you could have urinary incontinence when you can't hold pee. And I'm sure, many women will tell you, especially when you've had babies, multiple babies, you find out that you find it a bit difficult to hold your pee. So you may be laughing and you see that a little bit escapes, or you cough and a little bit escapes. But as one gets older and older, it's more than just a drop, And that's why you have women wearing, what's the name of those panties, that are almost like diapers sometimes. So you could have that with urine, you could have it with stool. Just having difficulty controlling the orifices for waste disposal.
Okay, thank you, doctor. Then the fourth question is, can osteoporosis be prevented, and what are the causes? Osteoporosis.
Osteoporosis can be reduced because osteoporosis really is, how do I put it now? The bone loss is increased by the hormone withdrawal. It has something to do with your hormones. And when you go, all of us will go into menopause. Menopause will come. So you will have that hormonal effect. However, the effect can be managed. If you've had your, exercising is the main factor, it's the main thing that helps to reduce osteoporosis. Good diet. You've had calcium in your diet, and our green vegetables are very rich in calcium. Green vegetables that are properly cooked, not overcooked. Milk and milk products help. But again, there comes a point where you can't take a lot of that. But beans also is quite rich in calcium. So if you've had a good diet of that, you're out in the sun, vitamin D helps, magnesium. But exercising and weight control, because obesity actually worsens osteoporosis. So exercising, weight control are the two, and then your diet are the three main factors that help you to manage osteoporosis. So if you've led a very active life, as you get older, then your bone loss, the rate of bone loss is slower. Everybody loses bone, but the rate is slower for those who are really active.
Thank you, ma'am. Then the next one is, what are the risks of taking pain reliever injections to the heart?
Sorry?
The risk. What are the risks of taking pain reliever injections to the heart?
Okay. I guess it depends on what kind of pain relievers. right? Thank God they've done away with analgin. That was one terrible one. Chloroquine injection is probably even worse on the heart. So, you know, people who love to take injections, as much as possible, do not, you know, except you have to. So if you've had surgery or you've had something that's giving you really acute pain, then take it. But otherwise, the pain relief that is available when you take your pain medications by mouth, maybe just 15 minutes behind the injectables. So as much as possible, avoid the injections. They all have different activities on the heart. Some don't affect the heart at all. Some affect the heart. If one is taking the narcotics, that can actually cause the heart to seize. You know, if given, as you well know, in large doses, more the respiratory system than the heart. But as much as possible, avoid injections. If there's any medication that you can take by mouth and it's available by mouth, let that be your first option. If it's available by mouth and you can take it by mouth, you're not throwing up, you can take it and it will work, please let oral medication be your first option.
Okay. We have just 2 more questions to go, Doc. He said, the next one says, what is your view on multivitamins for older women? And what vitamins are essential?
That question is very political. Multivitamins for women who eat well. Really, there may not be very much to it. It makes us feel good. There may be sometimes you know, if you have a good diet, then you're not likely to be lacking in vitamins. But many of us are not able to balance our diet. So yes, any of the vitamins, you have some that they say are Centrum for over 50, may be good for over 50-year-olds. Centrum may be good. Many of the multivitamins that I see around here have such minuscule active ingredients in it that they are just swallowing talk. Okay, many of them, the active ingredients in it is so tiny, it's so small that it's just swallowing chalk. It's not doing very much. But there are some that, you know, if you read the back of it or the content, those ones may be good for you. I am not sure I would say take it. The ones that I think may work, omega-3, for those who are not able to get out in the sun a lot, or those who are feeling down, omega-3 may help. Vitamin D, now we're being told that vitamin D is very good for our immunity. We're seeing more and more papers being published about the effect of vitamin D on our immunity. And many of us don't want to get out in the sun because, you know, you don't want to spoil your skin. So vitamin D may help. Vitamin C, because they say it's antioxidant, but there are many other kinds of antioxidants. The truth of it is that the science hasn't totally proven the benefit of added vitamins for someone who is not deficient, right? So if you're proven to be deficient, yes, you need replacements. But for those who, you know, you and I, good diet, you're managing yourself, you can take it. It won't harm you.
Thank you, Doc. Then the last question, is it okay to take calcium daily?
Yes and no. Yes, it's okay to take calcium, but be careful that you don't overdose yourself, because calcium actually accumulates in the body. And if you have excess calcium, especially as you grow older, your kidneys don't excrete things as well. And so it can build up in your kidneys. So you need to be careful with the dosing. There are all kinds of mega doses out there. If your body is not excreting it well and it begins to accumulate in your kidneys, then you have kidney stones, then that's even worse. Okay, so Yeah. So be careful with it.
Thank you very much, Doctor. That's the last question. We really appreciate. God bless you, ma'am.
And you all, thank you.